The other position is how to put your hands if you would like to release the diaphragms. So first position will be to release the pelvic floor. So you can see the spina iliaca anterior superior. You can see the crista iliaca, which is the border of the fourth and fifth lumbal vertebra. So I can also use the sheet and place my hands between L5, S1. This is the posterior hand, and the anterior hand is going with little finger to os pubis. So this is the placement or anatomical placement of my hands. I'm starting with 0 grams, which means that I use very little pressure, and then I'm press a little bit more. So I'm going deeper with 5 grams of pressure, and I'm waiting for some movement of diaphragms. So if the diaphragms are in tension, you can feel the tension of the diaphragm. So you are following the tension. And if you are getting to the tension, the diaphragms are starting to release. And release means very often the movement of the diaphragms. So you are following this movement until this movement stops. It means that the fascia or diaphragms is released. The other signs of releasing are heat, it's softening, it's lengthening. It can be also that my hands are going inside. You can see a deep breath. You can feel some pulsation under your hand, which means therapeutic pulse. So you can also feel, because we are in pelvic floor, some fluid movement. So this is the first position of releasing pelvic floor. So I'm moving to the diaphragm. So the other position is releasing the diaphragm, breathing diaphragm. So my posterior hand is between thoracic spine column and lumbal spine column. My position can be transversal, or I can be a little bit diagonal towards the opposite shoulder, which is more comfortable for her and for me too. And the anterior hand is below the ribs, so I can use my thumb, like my thumb is feeling her left ribs, and my fingers are feeling her right ribs. Or I can also use this position, so it's on you. And again, I'm in contact. I'm starting with 0 grams, then I'm going deeper, and I'm waiting for any sign of releasing, and I'm following the tension which I feel under my hands, the tension of fascia or diaphragms. And I'm following any movement or whatever movement is under my hands, which means that the diaphragm is releasing. And if the movement is disappeared or stops, it means that this is the end of my treatment. And the last position is on the thoracic inlet or outlet. So my posterior hand is going between the shoulder. I can be also transversal, or for me it's more comfortable to go diagonal. And my anterior hand is under sternoclavicle joint, under clavicle. So I'm not touching the breast. I'm in contact with the structures. I'm using 0 gram, and then I'm going deeper. I'm using 5 gram, and I'm waiting for some release, for some movement, and I'm following this movement. The other transversal diaphragms are hyoid and atlanto-occipital joint, but I will not show you this position right now.